Women in labour need to feel safe, private, calm and unobserved. Creating the right environment, whether it be at home or in the birthing room, is important work. If labour started at home, items that were useful for managing labour at home could be brought into the hospital. Continuing to use the same strategies that worked at home can help in the hospital environment too. At first, the birthing room in the hospital will feel unfamiliar and new. An unfamiliar environment can disrupt the hormones of labour and cause a slight increase in adrenaline. Adrenaline is the fight or flight hormone that can interfere with oxytocin and can temporarily slow the contractions. Once adrenaline settles, labour progresses again. Create a space that is comfortable, warm and familiar. Dim the lights. The darkness increases the hormone melatonin. Melatonin can enhance the work of oxytocin, and oxytocin is the hormone that creates the contractions of labour. The hospital room has furniture that may be useful to support labour. The hospital bed can adjust in many ways. Think of the bed as a piece of equipment to help with upright positions. Feel free to use a football, mats on the floor, and the furniture for comfort and movement. The bath and shower are also available for comfort. Sometimes the warmth, the sound, and the feeling of the water can assist with managing labour. Feelings of anxiety, excitement, and unease affect labour hormones. Leave worry and fear at the door. Stress can interfere with oxytocin and endorphin release, the body's natural feel-good hormone. Instead, support the work of birth by creating an environment that supports confidence. Choose to relax, soften, and trust. Scan the body for tension. Relaxation is the progressive softening of muscles that are tense. Starting at the head, work down, letting go of any tension that is felt. 4 parts of the body that often store tension are the forehead, the jaw, the tongue, and the shoulders. Practice progressive relaxation between contractions, focusing on these 4 areas. The work of birth is not only about contractions. The time in between contractions is also important. Deep relaxation between contractions is encouraged. Being relaxed in between contractions can make contractions more effective and more comfortable. A commitment to remaining as relaxed as possible during contractions will help labour. Although the uterus muscle is tightening, the rest of the body does not need to. Focus on surrendering and softening during contractions. As the contractions strengthen, focus on remaining calm. At times, relaxation may be more challenging to achieve. Feelings of fatigue, thirst, muscle tension and fear can contribute to this. Labour companions can address the underlying cause and offer appropriate support. Water immersion and warm shower water are also ways to enhance relaxation. Relaxation skills coupled with personalised rhythm is the key to managing labour. Find a rhythm to stick to during contractions. Examples of rhythm are breathing, vocalising, moving and visualising in rhythm. Many women use breathing rhythms that are gentle, soft and slow during the peak of a contraction. The rhythm is even, deliberate and slow, with the emphasis on the outward breath, which is an open, soft mouth. Breathing out for twice as long as you are breathing in helps to soften the muscles and quieten the mind. This helps the body to manage a long labour and calms the body if labour is fast. Breathing rhythms during contractions need commitment and focus. Women who prefer auditory rhythms may use low tones of sound with the breath. Women who prefer visual rhythms may look from one item to another with each breath. Some women use silent counting with each breath. Some women prefer movement such as swaying during contractions. Finding a rhythm that works is important. If it works, keep using it over and over again. Women find it very difficult to talk or respond to others during contractions. So it's best not to disturb her. Instead, provide support to help her focus. Commitment to relaxation and rhythm supports the work of birth. To help maintain relaxation and rhythm, sometimes medication options can assist. Labour is a dynamic process that uses the pressure of contractions to move the baby down. It rotates the baby in the mother's pelvis and squeezes the baby out. Whether a woman uses medication in labour or not, it is important to use movement and different positions. Being active and trying different positions helps labour to progress more quickly, more comfortably, and helps the baby out. The pelvis is a dynamic structure that moves and allows the baby to navigate the way out. Sometimes changing positions in labour can make a big difference in a positive way. When the cervix is fully dilated and the baby is nearly ready to be born, there will be increasing pressure on the back, the pelvis and the bowels, and there may be an urge to push. During contractions at this stage, the woman may make a groaning sound. This sound happens and is not easily controlled. Much like a sneeze, it just happens. This is the body's sign that it will soon be time to start pushing the baby out. Strong pressure is felt in the pelvis and in the bottom. These feelings are a good sign of progress. Go with the urges and let go. Listen to the body to decide which position is best for birth, because often the body knows best. During pushing, position changes may help bring the baby down and works with the body to move the baby out. Spontaneous pushing with contractions birth the baby. When the urge to bear down comes, go with it. Focus pushing effort deep down into the bottom. Keep that precious energy focused on opening up and letting the baby come through. The pushing stage can take some time and progress is usually slower for the first-time mother. When the baby's head crowns, guidance to just breathe or pant or just give a little push to ensure the most gentle birth possible. Soon the baby will be born and it will be ready for skin-to-skin time.